Are you confused about Australia's new Support at Home program? What happened to home care packages? Can some people keep existing arrangements? And how does the government decide the level of support that may be available? In this video, we'll explain Support at Home. Support at Home is Australia's government-funded in-home aged care program designed to support eligible older Australians to remain living safely and independently at home. Support at Home was introduced on November 1st, 2025, and it replaced the Home Care Packages program. The Support at Home program was introduced following recommendations from the Royal Commission into Aged Care Quality and Safety. The Royal Commission identified several challenges within the aged care system. The aim of the reforms is to help older Australians remain living safely and independently at home where possible. Depending on assessment, eligibility, and individual circumstances, Support at Home may assist with services such as personal care, including showering and dressing, nursing care, physiotherapy and allied health services, cleaning and household assistance, meal preparation, transport assistance, social support services, home modifications, equipment and assistive technology. Government-funded aged care services may be available to eligible older Australians who require support to continue living safely at home. Many people find the system confusing. A simple way to understand Support at Home is to think about two separate questions. Question 1. How much support does a person need? Question 2. What type of support does a person need? How much support does a person need? Following assessment, eligible participants may be assigned a Support at Home classification. The classification helps determine the level of funding that may be available. In simple terms, higher support needs are generally associated with higher levels of funding. While Support at Home officially uses 8 classifications, many people find it easier to think about them as low, moderate, and higher support needs. A simple way to remember it: classifications 1 to 2. Lower support needs people are often relatively independent, but may need assistance with housework, shopping, meals, transport. Classifications 3 to 5. Moderate support needs. People may require more regular support with personal care, mobility, medication assistance, allied health services, domestic assistance. Classifications 6 to 8. Higher support needs. People may require frequent personal care, nursing support, allied health input, complex care coordination, significant assistance to remain safely at home. Answering the second question, what type of support can be provided? Services may be provided across 3 main categories: clinical care, independence, everyday living. Clinical care includes services delivered by healthcare professionals. Examples may include nursing care, wound management, continence support, medication management, physiotherapy, occupational therapy, podiatry. Other allied health services. Clinical care services are generally fully funded by the government. Independence. The independence category focuses on helping people maintain function and independence. Examples may include assistance with showering and dressing, mobility support, exercise programs, social support services, transport assistance. Everyday living includes support with routine household tasks. Examples may include cleaning, laundry, meal preparation, shopping assistance, gardening, basic home maintenance. Why does Support at Home have different service categories? Support at Home separates services into clinical care, independence, and everyday living categories because different types of support are funded differently. The 3 service categories do not divide your budget into 3 separate pots of money. Instead, they help determine what services can be funded and what participant contribution may apply to each service. Support at Home may also provide access to assistive technology, home modifications, end-of-life care pathways. Important reminder, these examples are educational summaries only. Actual funding and classifications are determined through the aged care assessment process. Contribution arrangements are determined by the Australian government and may change over time. Some participants may contribute towards certain services depending on income, assets, pension status, service type. Support at home includes a lifetime contribution cap to help protect people who require care over many years. Once eligible participant contributions reach the government-set lifetime cap, further eligible contributions stop. The cap is indexed and may change over time, so viewers should check current Australian government information for the latest amount. How does the process work? Step 1. Contact My Aged Care. Step 2. An aged care assessment is arranged. Step 3. Support needs are assessed and a classification may be assigned. Step 4. Funding is allocated when available. Step 5. The participant selects an approved provider. Step 6. A care plan is developed and services commence. Waiting times may vary depending on location, urgency, and funding availability. Transitional arrangements apply to many people who were already receiving a home care package before support at home commenced. Individual circumstances may differ. People should check current information from My Aged Care or their provider regarding their own arrangements. Some participants may also have transitional protections relating to fees and contributions. What about CHSP? The Commonwealth Home Support Program, often called CHSP, has not yet fully transitioned. Current government plans indicate that CHSP is expected to transition no earlier than July 1st, 2027. When should families consider seeking help? Families may wish to consider contacting My Aged Care if they notice increasing difficulties with showering or dressing, managing medications, preparing meals, mobility or falls, social isolation, safety at home. If someone becomes suddenly confused, experiences chest pain, severe breathlessness, a significant injury, or another urgent medical concern, seek urgent medical attention. Thank you for watching Medical Explained. If you found this video helpful, consider subscribing to Medical Explained for more evidence-based health information. Watch our next video, 6 Things to Know About Dementia.